Is there any chance of this baby resembling the surrogate mother?
I like that. No, because you know, resemblance. You are talking about the physical features. Now, you talk about the physical features.
Those few cells mingling in there when the baby is growing.
So our physical features and our behavior are influenced by two things. They're influenced first and foremost by our genes.
Genes, yes.
Genes, they make the blueprint.
Yes.
Genes are the ones which lay the foundation for somebody being tall or short.
Or short, or fat.
Yes, or fat. All those things.
Yes.
To have skin color which is dark or light skinned. To have a certain type of voice, certain type of behavior. The gene writes the blueprint, but the gene needs to interact with the environment, to express itself. So where does this environment come from? The environment comes from the society. The environment comes from the parents. Yes. And if a baby has the genes for growing tall and you don't provide the food for it to express itself,
yes,
the baby will remain short and is carrying the genes for tallness.
Surely.
Yes. So it's an interplay between these two. So I am explaining this because although the gene makes the blueprint, and I say that the genes come from the parents, not from the surrogate.
True.
Yes. But if the parents are tall, for example, and then maybe the surrogate is a bit short, and then the baby ends up being short, you know, it's not the fault of the surrogate. It's the fault of the environment. Maybe when you get your baby, you're not looking after them well. Okay. Of course, it also starts from how do you look after the surrogate as well. Because the interaction with the environment starts from inside.
Starts from inside, okay.
Starts from inside.
Okay.
You might get a baby who is obese and you're like, oh, for us we are thin, what, you know. The environment in which you nurture the baby is not very nice.
True, doctor.
Yeah.
Thank you so much.
Yes.
I have a burning question from one of our listeners. Is saying that so if he wants to like have genes of tall children only, which environment should he look up to?
Yes. So as first of all, the blueprint has to be the genetics, and so you have the blueprint. Then you provide the material.
The material, this should be, the woman should also be tall?
Yes, I mean the woman or the woman who is the mother and the father of the child being tall is the genetic blueprint.
Oh, okay.
But then the environment where the baby grows must also be supporting that. So you have to make sure that you have the genes, or your partner has the genes.
Yes.
And then you look after the baby well. You will have a tall one.
A tall.
Yeah, you cannot. Yes.
Thank you so much, Doctor. It's still Medical Minds, and we're looking at surrogacy. We're looking at facts and myths about this topic. You talked about the extraction. Yes, there's a listener.
So, So, how fertilization is done in the surrogacy program. Yes. This usually confuses people, but let me try to make it very clear. Let's start from what normally happens in the situation of normal, not in IVF treatment. Now, a woman provides her eggs. She ovulates.
Yes.
The man provides the sperm. Now, if these two meet at the time of ovulation, the sperm will travel and look for the egg and fertilize inside the woman. That occurs in the tube. Naturally. Naturally.
Yes.
A baby is formed and goes and grows in the womb. And then later, 9 months, the baby is born. Yes. Now, what happens in IVF is slightly different from this. For example, if the woman's tubes are blocked, the sperm and the egg will not be able to meet.
To meet, sure.
Yeah, so there's a blockage.
Yes.
So what science has done is we can remove the eggs, and then we get the sperm, and we fertilize the egg with the sperm. Outside, we have the gadgets and the equipment in the lab, a specialized lab. So when the egg is fertilized, the process of fertilization results into an embryo. This is exactly like how it will be in the inside.
True.
Yeah.
True.
So after fertilization, the egg is kept for just a few days and then put in the womb. So in terms of function, we have bypassed the blocked tube. This is in IVF, in the usual IVF. Now, in surrogacy, we do fertilization the same way.
Okay.
Now, instead of putting that embryo or the egg which is fertilized back into the womb of this woman, because for some reason...
To the owner of the egg?
Owner of the egg.
Yes.
Because of some reason, she's not able to manage the pregnancy, or her womb is not there, you know. So we have to put the womb, the fertilized egg into the womb of another woman.
Another mother. That is the surrogate. Thank you so much, doctor. That is an excellent explanation.
Yes.
Yes.